Okay, welcome to our discussion on medical surgical nursing with some leaders from Boone Hospital. We have with us today Cheryl Eady, the Director of Medical and Surgical Services, Deanna Powers, Manager of General Medicine in the COVID Unit, Cheryl Stallo, Manager of Surgical Specialties, Shanna Marshal, Manager of Orthopedics, and Michelle Sprague, Manager of Oncology and Neurology. So thank you. I think it's very exciting. We're trying to put together a series of webinars on careers in nursing and nursing specialties, and it seems very appropriate that our first one is what I consider kind of the backbone of nursing when we talk about medical surgical nursing as a primary specialty for nurses. So I thought what we'd do is go around and have you each kind of discuss what your role is and position, and maybe a little bit about the kinds of units you oversee, what it means to be a nurse manager, and what your patient population is. And should we start with Michelle?
I'm happy to. I am a newbie at Boone compared to the other ladies you're going to speak to here, but I have been in nursing for a little over 30 years, and I currently am the manager for, 6 South, which is Neurology, Oncology. We're a 32-bed unit, and then I oversee the palliative care program, the stroke program, the cancer registrars, and our COC. And then guide me on what kind of patient clientele do we serve? We serve anyone that comes in and has a neurological issues. So from stroke to seizures to a new diagnosis of anything that we do neurosurgery. So anyone that has sees Dr. Ryan or Dr. Bondurant for a surgical procedure, we get them. And then we also see oncology patients. So anyone with a new diagnosis of cancer coming in for chemotherapy or has complications related to their cancer or cancer treatment, we provide care for. And then our third class of people is our end of life. So we do a lot of palliative care. So if we have a patient in the ICU who is care is withdrawn or extubated, they come up to our floor or any of the other floors where they determine that they'll proceed with end of life care. So we serve them as well.
Okay. So what makes you passionate about that area of nursing?
Well, I think I've said this, and the patients that we admit here have had a life-altering event. They have had something that has drastically changed their lives. And what makes me passionate about that area is that even we need to be here to make that they're their most vulnerable population, and we need to be here to make that time informative and communicate with them and help them with the changes and help them figure out a new way of life or routine. And it's hard to put the cards that we receive and the family input and them coming up to the desk or just thanking us for the care that we've provided them during this transition is why I do what I do.
Great. Thank you, Michelle.
You're welcome.
Shanna, Marshall, would you like to introduce your field a little bit?
Hi guys, my name is Shanna Marshall. I'm the manager of Orthopedic Specialties. Like Michelle's unit, it's a 32-bed space. I've been at Boone for about 24 years now. I started here as a patient care tech in cardiology and have worked in many different areas, including surgical specialties and the pre and post-op areas, so PACU. Orthopedics, Columbia Orthopedic Group is the primary group that works here with us. We do a lot of joint replacements here, hip and knee replacements, some shoulder replacements, some ankle replacements. We do a wide variety of spine procedures here as well. And then we have our fracture specialist. So we see a lot of fractures, especially this time of the year as we get into fall and winter. What makes me passionate about ortho, I think surgical procedures in general, I've always kind of been drawn to that area. I like the fast pace of the area. I like the unpredictability, and I like the idea that a patient can have a debilitating condition for some time and then have a surgical intervention, and then in 1 or 2 short days can go home with a whole different outlook because of that intervention. So I like the resolution of that. So kind of ortho in a nutshell, unless you guys have questions.
No, that's great. Cheryl Stallo, would you like to introduce yourself?
Hi, I'm Cheryl Stallo. I am the manager of the Surgical Specialties unit here at Boone Hospital. I have been with Boone for, in total, about 18 years. Shanna kind of stole some of my description of my my passion for surgical patients. Surgical Specialties is what I always tell people during an interview is that it's a great place to learn a lot about a lot. We have a huge variety of surgeries that we see here, from gynecological procedures, urology, general surgery, vascular, ear, nose, and throat, breast surgeries, plastics, wound, bariatric. Our bariatric program is actually growing exponentially currently. So a lot. We are really the poster child for a true med-surg unit, because obviously all of those patients also have medical problems when they come into the hospital. My background too, like Shanna's, I spent a lot of years in PACU, so perioperative and surgical nursing is it's in my blood, and I too really like the fact that you can come in and have whether that's a mass or anything like that, and within a day that's removed and the next day you're going home. I really like to see that fast progression and that you're actually going in and doing something about the problem. So that's surgery.
Yes, it is. I did a little surgery, surgical nursing early on, and I have to agree that compared to medical issues, that resolution is very satisfying in a different kind of way.
Yes.
Deanna, you might have a different. Hi. You're muted. Hold on. There you go.
Is that better? You can hear me now?
Yes, thank you.
Hi, I'm Deanna Powers. I'm the manager of medical specialties and dialysis. Currently, our medical specialties unit is now a COVID unit, so learning lots of new things about that. For medical specialties, we were seeing patients who have end-stage renal disease on dialysis, patients with diabetes, pneumonia, wounds, infectious diseases, GI issues, lots of different respiratory issues. So it's a little bit of everything. So that certainly is a great place to learn and really enhance your skill set in that particular area. So we see patients from 17 to the oldest I've seen is 107. So, and everything in between. So people come into the ER most generally and don't know what's wrong with them, come into the hospital, have some testing done, maybe get a diagnosis and a treatment plan, and they go home and continue on with the treatment plan. Or we have some of our patients who are chronically ill that return to us, and we're familiar with them and continue to treat them for whatever their issue happens to be. So we have a little bit of the whole continuum, if you will. As far as COVID is concerned, it's getting busier and busier by the day, and we see a wide variety of ages there. And that's not necessarily just medicine patients. That could be anybody that comes in the door, but anybody who's positive comes to our unit. My background really is not medicine, but I've had 25 years of OB experience, and took this on as an offer, honestly. Would you go be the manager of the unit on medicine? And I was ready for a change at the time and fell in love with the staff that work here that were as passionate about these patients as the OB nurses were about our mom. So that was really intriguing to me. And I've been on medicine now almost 10 years and haven't gotten bored a day yet. So continues to challenge me and teach me every day.
Great. Thank you. And Cheryl Eady.
Hi, my name's Cheryl, and I have been a nurse for 40 plus years. We won't get too specific there. My clinical background is that of a cardiovascular nurse specialist, and particularly the surgical aspect of that. And most of my career, though, has been spent in some type of leadership role, ranging from everything from nurse manager to CNO, COO, and I have done that both here in the US in various states, as well as abroad in the Middle East. I had previously worked at Boone for 10 years, from 2003 to 2014, and at that time I was director of about 6 of the units here: cardiovascular, surgery, cardiology, rehab, neuro, orthopedics for a while. And then I moved for 5 years as the director of quality and infection prevention. And then I also happen to be a data geek and love data analytics and all that it can reveal about what we do. And I am very blessed to have just recently returned to Boone and to get to work with my 4 outstanding colleagues who just introduced themselves.
Thank you. So I wanted to kind of have a discussion a little bit about what your role is as nurse managers and nurse leaders. But also, what does it take to be, maybe we should start first with the nurses and the clients that they work with. You know, what do you look for in a nurse in medical surgical nursing? What would be some of the drivers that you want in a really good, what makes a really good medical surgical nurse or a nurse in your field? What kind of characteristics are you looking for? And what gives you staying power in that area? Anyone?
I think flexibility, first and foremost. I think if we've learned anything in the last 6 months about healthcare, is that you have to be able to pivot on a dime. And that's always been important. I think that it's just becoming more and more important.
What do you mean by flexibility, though? In what way? Like, not that I can do it back then, but.
Yeah, no, I think, you know, with the COVID population in particular being something that a year ago, none of us would have been able to wrap our minds around how that would affect us so much. You know, being from a surgical unit and how that affected, are we going to be able to continue to do elective surgeries? And there was a time over the last 6 months, we did pause that for some time to ensure we had enough beds and staff to take care of a coming surge. And that flexibility, my staff in particular has, you know, been asked to flex to combine with another unit during a time of when surgeries weren't happening as readily, and then flex back. We've done a unit move. Actually, this week we moved our unit to kind of make better space, better use of our space for that COVID population that is increasing. So that flexibility has become even more essential in our nurses and our managers as well. So.
Anyone else want to comment on what they're looking for in, what makes a really good medical surgical nurse?
I look for somebody who has a great attitude. If you're willing to jump in and learn something new every single day, and be okay with that, then that's the person that I'm looking for. It's really difficult. We think that we can come in 6 weeks be oriented to a new job and here you go, knock yourself out and go for it. When in reality, it really takes about 3 years for somebody to learn their job. There is so much going on in nursing, so many changes, so many new meds, new treatment plans, so many things. And particularly in medicine, and not unlike anywhere else, but with our medicine patients, they may have more than one thing going on, and most typically do. And that takes a little bit of time. You have to learn all of those different diagnoses and care plans and meds and that type of thing that you really can't learn it in a 6-week orientation. I tell people all the time, you will learn, and really what you learn forever, but what you're really doing is filling your gut bank so that when something happens with your patient, you're not reacting anymore, but being proactive. And that takes time to learn those things and to understand, how do I manage this and what do I need to be thinking about? And I've seen this before, so this is what I did. Let me go try this right now before something else occurs. So it's always thinking on your feet and understanding that, but I really like to let people know that it takes a long time to learn nursing. You go to school and you learn what you need to, and then you come and it's a little bit different when you get in real life and you're taking care of more than, 1 or 2 patients that you're doing in clinicals, and which is what you have to do in clinicals. But really putting that all together takes some time for people. And so to be patient with themselves and to take care of themselves and let themselves learn.
I want to just add to Dina's comments. Totally agree. And I always have said that it's okay to be scared. I actually want you to be a little bit scared. If you come in here acting like you know it, it's going to be hard and troubling for you. So I always say it's okay. And about that 2-year mark, like Dina said, 2 to 3 years. I remember the first time, I think it was 2 years and 1 day, I started an IV on an infant by myself. I didn't have someone there holding my hand or supporting, and I was like, oh my gosh, I did it. But it was 2 years before I felt that way. And so, and the other part of that is, this is a team sport. And everyone, there are moments where it's all hands on deck. And if people have, if you take care of others, others will take care of you. And I see Natalie on here. She's been up here a couple of times, and it has been crazy the past couple of weeks. And you will hear someone call out and say, I need help in room 24. And you have people back on the Vocera like, I'm on my way. And it's sometimes it's just one of those days. And so it's everybody on the same team.
Good point.
I think to add to that, to what Michelle and Deanna just said, you are new, but we, at least at Boone, we do have a good complement, I think, of really experienced nurses. So there are a lot of really fantastic resources, I think, on all shifts. So you always have that. But I think beyond just skill, we have nurses that have tremendous skill here, and you'll learn skill. But whenever I interview someone, I always talk about it's all the other stuff too. Patients have very high expectations when they come to Boone, whether it's an elective procedure or if they're coming in through the ER. And so, I think they expect a very high baseline of care that they're going to receive here. So, it's all the cliche stuff about being a good teammate and treating patients like they were your own family member. So, it's really that going above and beyond to make people feel like they're not just a number here, and that you don't have 6 other patients at one time, that they're the only person. So I know that sounds like a little hokey, but I think when we really get down to it, that's what they really expect of us, beyond getting really great care and great outcomes. That's just their baseline expectation.
Excellent. Thank you.
And having said that, Shanna, thank you. They also realize we're human. And so it's so easy to go in and make excuses for things that one are not in our control, or maybe they are, but sometimes they just want to hear, I am so sorry that we are behind giving your meds today, or I am sorry that your test got delayed a bit, but just acknowledge it and own it and let's move on. But I think sometimes they just need that and a good listener.
Yeah. So how did you move into your leadership roles? And I'm not sure everybody knows what the role of a nurse manager is. Would anybody like to speak to that? What was your journey to leadership in nursing?
It's
Just in a
fun
few sentences.
to see everybody smiling. I don't think we all had intended to be in the, we didn't all set out and say we're going to be nurse managers. For many of us, I think, for me, I was a supervisor and my nurse manager never returned from a leave. And they're like, hey, you want to be a nurse manager? I'm like, okay. And that's kind of how I started to get into the nurse manager field. But I think doors have opened and I think we've jumped into it. And so what is a nurse manager? I think it's a whole lot of different things. I don't even know where to begin. But one of the most important things is to lead a team, to hold them accountable, but also provide them with good feedback and praise them, and then guide them down the right path. So whether it's something new that we're bringing to the floors, or some changes, like I think Cheryl talked about this. We all were on one floor for a period of time. Cheryl, Shanna, and I all had nurses on, and our patients were mixed during our initial surge. And it's being out there and supporting our staff, because it was hard and it was a challenge. So I think for many of us, it's wearing multiple different hats.
I like to liken that being a nurse manager is when you have your staff and they're out there taking care of patients all day long, who's taking care of them? That's the manager's job. Their manager is in charge of making sure that their schedule works for their life, but also holds them accountable, and ensures that consistency in how staffing happens. And sometimes it's a shoulder to cry on, sometimes it's someone to vent to, sometimes it's a problem solver. The manager has to do all of those things. So yeah, my job is to take care of my staff. That's first and foremost.
I think it's really just giving staff the tools and resources to be their best. And that comes in lots of different forms and fashions, but that's really what it boils down to, breaking down those barriers and giving you what you need to do your job the most effectively. And every day that looks a little bit different.
I agree. I tell people when I interview them, we are all on the same team. I just have a different job than you do. And my job is to remove your barriers so that you can take better care of our patients. And all of those other things that everybody's talked about. I'm not sure you can pinpoint what a manager does, because it is different every single day.
So I did want to ask too a little bit, well, and actually as the Director of Medical Surgical Nursing, Cheryl, did you have something to share? Kind of, now we've had another layer of management. What does that mean for the nurses and the patient, and how you support your managers?
I see my job as one of facilitation and collaboration. They know their jobs. They know how to do them in an excellent manner. Some of the time, what I see mine is doing is kind of like a conductor at times. Conducting an orchestra is bringing and trying to help ensure that we are all aligned, and as much as possible, moving in the same direction and using standard work so that what we do and that delivers these excellent outcomes can be replicated, and that we're also doing it to ensure that we provide an excellent patient experience as well as an excellent experience for our staff. I think they all said it very well. Our job is to take care of the staff who take care of the patients and to support them in a multitude of ways.
Excellent. Well, I also wanted to get into a little discussion on the current COVID situation. So we've been experiencing it about 8 months by my count, maybe 9, depending on how you count. With some, we're in a difficult situation now as a country and even as a county with our rates being elevated. Boone has had its own, Boone County or Central Missouri has had its own experience with the COVID. And I'm wondering what you've learned, what your journey has been, and how are you facing the current challenges, kind of generally or organizationally?
All right, I'll talk. Organizationally, we have in place an incident command center. We have leaders in the hospital who have taken on different aspects of a command center, and from operations to communication to staffing, what have you. And somebody else might be better speak to that. But so we have an incident command center. It was in place at one time. We actually went virtual with that for a short time, and it is back now live again. And they really are able to help problem solve and think about different things that are going on house-wide, which has been wonderful help, I think. As the manager of the COVID unit, let's see, you have to tell me what was your question again.
Well, I'm kind of wondering what the journey's been from what we've known. When I reflect back to, like, New York and Washington State got hit so hard early on, and that didn't manifest in the same way for Missouri. And now it seems like a lot of states that kind of dodged the initial bullet are really getting swamped. And so have we been able to learn what works best for caring for our patients? It seems like we've improved some treatments. And what does that mean for the nurse caring? How has nursing responded?
So we've done several things here at the hospital. Medicine was initially in a part of the building that we could not make all of those rooms negative air pressure rooms, which is what is needed for these patients if they're getting aerosolized treatments of some kind. So we had to figure out where we moved to 3 South and opened a COVID unit, which was a 20-bed unit at the time. And fairly rapidly, over a month's time, we became full on that unit, and that unit stayed pretty full. We started overflowing some of those beds that then, we didn't have room for. So within about a week's time, we figured out that 20 beds was not going to be enough for us. So then what was our next plan? It seems that we are always looking ahead and planning ahead for what ifs. So just this late last weekend into today, we moved patients from a 20-bed unit to a 32-bed unit. But that meant moving surgical patients off of a unit and swapping units with medicine, basically. We ended up leaving our general medicine patients on that floor, moving all of the patients from the small 3 South COVID unit to the 32-bed unit in order to be prepared for with more beds. Today we're full at 32, and we're looking ahead. What do we do next? What happens next? We are running in part of the thick of it. I think we're still running uphill a little bit personally, but I think we continue to plan on how do we manage admissions coming through the ER. How do we manage our census going up with COVID? How do we manage the ICU? What happens with the patients who are intubated? What happens with respiratory therapy? There's everybody. So many people are affected by this. Finance has been a big part of this as well. And the nursing staff are phenomenal. They continue to come every day and take care of these patients. Sorry.
No, I think we understand it's been a heroic effort.
It has been, and the staff, and the nursing staff, the medical staff have all been very flexible and resilient in providing care for these patients. They have let us know the acuity of these patients is different. It is higher. We've got to have better ratios. We've learned from that, and we've modified that so that they can provide the level of care needed and to help ensure that we're keeping our staff safe as well with those ratios. Because you don't want someone rushing and forgetting some aspect of PPE or something with this population. And, it's about what all of the managers are doing is listening to their staff and supporting them every step of the way here. And the fact that it was Cheryl, Stallo, and Deanna's units that totally had to flip units. And that took a lot of planning on their part. And then the actual day of the move, a lot of physical effort as well as mental effort and stress on the part of their staff in making that happen. And they did an amazing job. It required support from everyone in the organization. We had to have computer support, housekeeping support, everything. So
I think you make a great point, Cheryl. To say flipping the unit sounds like changing the linens, but it's monumental, right? There's
right.
a lot of tracking, and in today's day and age, there's a lot of electronics that are involved, and I think it's much more complex than the average person can imagine, and yet it's done in a very short amount of time frame, and it's a major upheaval. It has to be. So that kind of presents like an additional stress to the entire working unit to pivot and make that kind of a change. So it's a very interesting time, and certainly nursing, I think, is right at the forefront of this current crisis and response. So I applaud everything you're doing, and thank you for sharing with us what's happening and how the nurses are responding. I don't know if there's more is there any more to that story that you'd like to share that people should know in going into nursing or considering nursing as a career? This is the current challenge, right? There was one before it, and there'll be another one after it. That is the new situation that we're trying to figure out in healthcare and deal with. What it'll take away lessons, perhaps?
I think one thing that we may not have touched on is just how much our staff nurses are really being that advocate for that patient, as well as that family. And, with the restrictions on visitors to the hospitals now in light of COVID, how do we ensure that family members know what's going on with their loved one? How do we ensure that they can have a FaceTime meeting or, something via the iPads? Because we don't have the usual support systems in place that we did before. So the nursing staff have gotten very creative in how they manage that, and on top of an even higher workload.
Good
I
point.
think that's a really good point, Cheryl. And you said earlier, Noreen, you know, it affects us. And of course, you see Deanna, a manager of 30 years, in tears. And I watch every one of these nurses out here working so hard. And here we, like Cheryl said, have no visitors. So how do we still keep them in the loop without getting 4 and 5 phone calls from each patient, which is interrupting which is adding an additional. So I think all of us as managers have tried to be very proactive in figuring out how that works and how do we best get that one person, and how do we give them the message that we really depend on you to share the information with the rest of your family. And so I think we all talk daily to try to figure out the best way to do that and be proactive. And again, supporting our nurses. And when Cheryl said flexibility earlier, this is flexibility. It's moving from one unit to another. It's taking patients that we don't normally really take up on here, but still providing them with great care. But we're trying to figure out how it works best for everybody. So Deanna, stop crying. It's okay.
I'm gonna, what are they're tears of pride, right? Tears of, yeah. So, you know, thank you so much. This has been wonderful. I want to open the questions up to our students and prospective students who are online or may have a thought that they'd like to comment on. Just unmute your mic.
No, I just wanted to share, I really appreciate all you ladies taking time out of your day to come speak with us, and kind of, it is nice to have a little bit of insight into, you know, the future and what's needed and what you guys are looking for and the kind of things that you guys go through. And I appreciate what all of you are doing. So wanted to share that. Thank you.
Thank you, Lena.
I just had a question about how each of you chose your particular field of nursing. I'm currently a flex tech at Boone, and I'm usually on most of the floors. And of course, there's a couple that I don't like, but I have a couple that I like. How do you choose what your specialty is?
That's a great question. I think that's the beauty about nursing, is if something doesn't work for you in one area or it doesn't suit you, then there are options. And I think we've all had options. I started out in NICU and I was there for years and years and years. And I had my own personal tragedy, and I switched to adults. And I was like, what have I been missing all of these years? So I spent 24 of my years in pediatrics. And so now I feel like I've been to the gamut. I've went all the way from bringing these little tiny beings into the world and all the way to taking them out. And I don't mean taking them out in that way, but I've been there on their journey as their life ended. And so I have been blessed to have had an opportunity to have many opportunities and a lot of different experiences. What brought me to this? I kept talking to Deanna, and I was in palliative care. And what brought me to this place right here is I came up here on this floor, and Deanna was managing 2 different floors. And every time I walked up here, I just felt a need to be in this area. And I had already been in palliative care and worked with patients at the end of their lives. And so I kept talking to Deanna, and after a while I applied for this position. But that's kind of what brought me here, is I just came up on this floor and it felt right for me. But
And I'm really thankful for you doing that. Sorry, Cheryl.
It's okay. So I kind of mentioned a little bit earlier that my background was in surgical care, perioperative care. I started my career on a med-surg unit in Kansas City, and it was a general surgery and orthopedics unit. And when I relocated to Columbia, I got a job with Boone Hospital, but I was working in a family practice clinic. And it was I was actually there on day one. We had 0 patients, and it was an interesting, situation to be in. I learned a lot as we grew that practice, but within the next year, I realized I really want to get back to the hospital, and I really liked surgical patients. And a position opened up in recovery room, and I stayed there for 9 years. I really liked the fact that someone came in wide awake, we put them to sleep, did this massive, amazing work on them, and then they walked out a few hours later. And sometimes that was a couple days later, but still, that process was just always amazing to me, that that can all just happen while they're asleep.
I think the bottom line is all of us are going to have similar stories to that. We've all done lots of different things in our careers because we're all much, much older than you. But I think like Michelle said, nursing, like don't be scared because you're not pinned down to one thing. Like you might do something for a while, and you might that might be what you want to do for a while. And then life leads you in different directions for whatever reason. So that's really the cool thing about nursing. You'll never need a job because you can go anywhere, literally. And I think the opportunities are endless. So just don't put too much pressure on yourself to say, this is what I'm going to do and I have to do that forever, because you don't. There's always doors that open somewhere else. And maybe you find that one place, and there are nurses that do that. They stay in one place forever, but certainly don't have to.
I've done a lot of different things in my career. I've worked at the VA. I did 25 years in OB. I did pediatric psych for a very short time. I have done a lot of different things. And how did I end up here? I just kept saying yes to the open doors. Every time somebody would ask me something, I was like, sure, I'll try it. And that could have been a physician that led me into one way, or a boss that said, can you do this interim? And I've done a lot of interim things. And I just kept saying yes, and never, ever in my wildest dreams did I think I would be a manager, nor did I think I would be on medicine for that matter. So I just kept saying yes, because the opportunities are just endless in nursing, which is what makes it such a wonderful career.
Well, that's wonderful. Thank you all so very much for joining this webinar and launching our first one. I truly, truly appreciate everything you're doing for our community and our nurses and our patients every day, and for Stevens College nursing students. So thank you so much. Have a great one.
Thank you.
Thank you for having us, and we look forward to having the students here. And you guys feel free to come up to any of us if you want to talk, ask us more questions. Travis, we're happy to answer anything.